What is M-pox? M-pox, formerly known as monkeypox, is a viral disease caused by the M-pox virus, which belongs to the orthopox virus genus, the same family as the smallpox virus. M-pox was first discovered in 1958 when 2 outbreaks of a pox-like disease occurred in monkeys kept for research, hence the name monkeypox. The first human case was recorded in 1970 in the Democratic Republic of the Congo, DRC. The virus is primarily found in Central and West African countries, but outbreaks have been reported in other regions, including Europe and North America. The disease was renamed M-pox in 2022 to reduce stigma and better reflect its transmission and epidemiology. 2. How does M-pox spread? M-pox spreads primarily through close contact with an infected person or animal. Transmission can occur through direct contact with bodily fluids, respiratory droplets, or skin lesions of an infected person. It can also spread by touching contaminated objects, such as bedding or clothing. In some cases, M-pox can be transmitted from animals to humans through bites or scratches, or by handling infected animals, particularly rodents like rats and squirrels, which are natural reservoirs of the virus. Human-to-human transmission is less common but can occur, especially in close, prolonged contact situations, such as in households or healthcare settings. 3. What are the symptoms of M-pox? The symptoms of M-pox typically appear 5 to 21 days after exposure and can last for 2 to 4 weeks. The disease usually begins with flu-like symptoms, including fever, headache, muscle aches, and fatigue. Swollen lymph nodes are a distinctive feature of M-pox, differentiating it from smallpox. A few days after the onset of fever, a rash develops, often starting on the face and then spreading to other parts of the body, including the palms and soles. The rash progresses through several stages, from macules to papules, vesicles, pustules, and finally scabs, before falling off. In severe cases, the lesions can be numerous and painful, leading to secondary infections and scarring. 4. Who is most at risk of contracting M-pox? People living in or traveling to regions where M-pox is endemic, such as Central and West Africa, are at higher risk of contracting the virus. Those who come into contact with infected animals or consume bushmeat are also at increased risk. In non-endemic regions, close contacts of infected individuals, healthcare workers, and those in close proximity settings, example households, schools, and prisons, are more vulnerable. Additionally, individuals with weakened immune systems, such as those with HIV/AIDS, and unvaccinated people are at greater risk of severe disease. 5. How can M-pox be prevented? Preventing M-pox involves several measures. Vaccination is an effective way to prevent the disease, particularly for people at high risk. The smallpox vaccine, which provides cross-protection against M-pox, can be used in certain cases. In addition to vaccination, practicing good hygiene is crucial. This includes frequent hand washing with soap and water, avoiding close contact with infected individuals, and not sharing personal items like bedding or clothing with others. Travelers to endemic areas should avoid contact with wild animals and refrain from consuming bushmeat. In healthcare settings, strict infection control practices, including the use of personal protective equipment, PPE, are essential to prevent the spread of the virus. 6. Is there a vaccine for M-pox? Yes, there is a vaccine for M-pox. The smallpox vaccine, which was used to eradicate smallpox globally, also provides protection against M-pox due to the genetic similarities between the two viruses. In addition, a newer vaccine, JYNNEOS, also known as Imvamune or Imvanex, has been specifically approved for M-pox in some countries. This vaccine is a non-replicating live virus vaccine and is safer for immunocompromised individuals. Vaccination is recommended for people who are at high risk of exposure, such as laboratory workers handling orthopox viruses, healthcare workers caring for M-pox patients, and people in outbreak settings. Post-exposure vaccination can also reduce the severity of the disease if administered within a few days of exposure. 7. What should you do if you suspect you have M-pox? If you suspect you have M-pox, it is important to take immediate action to prevent the spread of the virus. Start by self-isolating to avoid contact with others. Contact a healthcare provider or local health department for guidance and to arrange for testing. It is crucial to inform them about your symptoms, travel history, and any potential exposure to infected individuals or animals. Follow the advice of healthcare professionals regarding treatment and isolation. If diagnosed with M-pox, continue to isolate until all lesions have healed and scabs have fallen off, as the virus can remain contagious during this time. 8. How is M-pox treated? There is no specific antiviral treatment approved for M-pox, but supportive care and symptom management are the mainstays of treatment. This includes ensuring proper hydration, managing fever and pain, and treating any secondary bacterial infections that may occur due to skin lesions. In severe cases, antiviral medications like tecovirimat, CEN-246, which was originally developed for smallpox, may be used under investigational protocols. Healthcare providers may also administer immune globulins to boost the body's immune response. Hospitalization may be required for severe cases, particularly in individuals with weakened immune systems or those with extensive skin lesions. 9. What are the long-term effects of M-pox? Most people recover from M-pox without long-term consequences, but the disease can have serious complications, particularly in severe cases. These can include secondary bacterial infections of the skin, pneumonia, sepsis, encephalitis, inflammation of the brain, and eye infections that can lead to vision loss. Some individuals may experience permanent scarring from the skin lesions. In rare cases, especially in immunocompromised individuals, M-pox can be fatal. Long-term psychological effects, such as anxiety and depression, may also occur due to the disfiguring nature of the disease and the social stigma associated with it. 10. How is M-pox different from other viruses like smallpox or COVID-19? M-pox, smallpox, and COVID-19 are all viral diseases, but they differ significantly in terms of transmission, symptoms, and public health impact. M-pox and smallpox are both caused by orthopoxviruses, but smallpox was far more deadly and had no animal reservoir, allowing for its eradication through vaccination. M-pox, while similar in some respects, is generally less severe and less contagious than smallpox. COVID-19, caused by the SARS-CoV-2 virus, is a respiratory illness with a very different mode of transmission, mainly through airborne particles. COVID-19 spreads more easily and rapidly than M-pox and has caused a global pandemic with millions of deaths. The symptoms and complications of COVID-19 also differ, with a focus on respiratory and systemic issues rather than the characteristic skin lesions seen in M-pox and smallpox. 11. What is the current global situation regarding M-pox? The global situation regarding M-pox is evolving. While historically confined to Central and West Africa, recent years have seen outbreaks in non-endemic countries, including Europe and North America. These outbreaks have raised concerns about the virus's potential to spread more widely due to increased global travel and the interconnectedness of communities. Public health authorities in affected countries have responded with enhanced surveillance, vaccination campaigns, and public education efforts to control the spread. The World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, continue to monitor the situation closely and provide updated guidance on prevention and control measures. 12. Why is it important to stay informed about M-pox? Staying informed about M-pox is crucial for several reasons. Awareness and education are key to preventing the spread of the virus, particularly in non-endemic regions where people may be unfamiliar with the disease. Understanding how M-pox is transmitted and what symptoms to look for can help individuals take appropriate precautions and seek timely medical care. Public health responses are more effective when communities are informed and engaged in prevention efforts. Additionally, staying updated on the latest developments regarding M-pox, such as new outbreaks, vaccine availability, and treatment options, is important for both personal and public health safety.